Mr. Zaid will start first.
Thank you, Chair, and to the Standing Committee for the invitation to appear here today. My name is Jonathan Zaid, and I'm the founder of Canadians for Fair Access to Medical Marijuana, commonly known as CFAMM, and I'm a medical cannabis patient myself. I will introduce CFAMM briefly and then pass it off to James, the President and CEO. CFAMM is a national nonprofit organization which has successfully represented medical cannabis patients since 2014. With a membership of over 20,000 Canadians, the organization has emerged as the thoughtful, grassroots voice for medical cannabis in the nonprofit advocacy space. We are also joined by a coalition of nonprofit organizations who are also recommending the elimination of tax on medical cannabis. The coalition includes the Arthritis Society, the Canadian AIDS Society, the Canadian Arthritis Patient Alliance, Canadian Hospice and Palliative Care Association, Canadian Nurses Association, Canadian Pharmacists Association, the Canadian Spondylitis Association, the Cardiac Health Foundation of Canada, the GI Society, the Huntington Society of Canada, and the Multiple Sclerosis Society of Canada. Affordability of medical cannabis remains an urgent crisis for the majority of patients. Insurers rarely cover the cost of medical cannabis, meaning the majority of expenses are paid out of pocket. The reason we are before you today is to discuss Bill C-74's proposed application of sin taxes on medical cannabis, which, if passed, will be detrimental to the 269,000 Canadians using cannabis for medical purposes. We are calling on you to support the rights of sick Canadians and drop the proposed excise tax on medical cannabis. Now I'll pass it off to James.
Thank you, Jonathan. Hi, my name is James O'Hara, and I'm the President and CEO of Canadians for Fair Access to Medical Marijuana. I'm also a former bank vice president who is now a medical cannabis patient. I have a number of conditions which I successfully treat using medical cannabis: focal seizures, osteoarthritis, and asthma. The use of medical cannabis in my life has been utterly life-changing. I truly mean life-changing. I've been able to reduce the number of seizures I have by about 80 to 90%, and my overall quality of life has increased dramatically, and I'm far from alone in my experience. Today, over 250,000 Canadian medical cannabis patients get relief from symptoms from various conditions and illnesses, including chronic pain disorders, arthritis, insomnia, MS, Crohn's disease, epilepsy, just to name a few. Yet fully 60% of these patients cannot afford their full dose. It's already out of reach for them. What we've heard from patients are some very important points, and that is they're making very difficult life choices. Many say they will source from the black market. They feel they have no choice. And even if there's an element of product safety risk, they will still do so. Some have dipped into their savings or used their credit lines to pay for medicine. Others say they will go without or just go back to using opiates, which are covered by insurance, just to get some relief from their pain. Keep in mind that this is a medicine whose cost is already significantly burdened by HST, and it shouldn't be. Other medicines in Canada are zero-rated and not subject to any tax. These patients are already struggling to finance the cost of their medicine and even putting themselves and their families in financial jeopardy. And frankly, in a country like Canada, this is completely unacceptable. Yet today, the government is considering adding another tax for medical cannabis patients, an excise duty, or what is commonly described as a sin tax. Let's just understand and remind ourselves for a minute what a sin tax is designed to do. A sin tax is imposed on items whose use is deemed harmful to society, such as alcohol and tobacco. It's primarily designed to disincentivize use. For medical cannabis patients, cannabis is harm and symptom reducing, not harm creating, and does not fall into these categories whatsoever. Moreover, sin taxes are designed and used to discourage consumption, something a medical cannabis patient has absolutely no choice over whatsoever. Think about this for a minute. A sin tax on medical cannabis patients is imposed to deter use. That's effectively discouraging sick Canadians from using their medicine, and that makes no sense. And go back to what I said earlier. Medical cannabis patients are already significantly burdened and are struggling to pay for their medicine. And that makes no sense. This proposal puts their medicine out of reach even further. Struggling patients can't understand why, when they're doing their very best to take care of themselves, that the government would propose to tax their medicine and treat it like alcohol, tobacco, or gasoline. To disincentivize the responsible management of someone's medical needs makes absolutely no sense, and applying a sin tax to medicine is completely out of line with our collective moral beliefs and principles as Canadians. This is a reason why every jurisdiction in the United States has both medical and recreational cannabis systems, either partially or fully exempts medical cannabis from taxes. Germany takes it a step further and mandates insurers cover the cost for patients. It's also very important to highlight that the 269,000 patients utilizing Health Canada's ACMPR medical cannabis program today are people who are using healthcare provider authorized medical cannabis products, which are not considered to be prescription medicines and therefore would not be exempt from excise tax. This means that these Canadians will potentially face unfathomable and increased costs post-legalization due to the new taxes being placed on their medicine. Although the government has made one small step in exempting low THC products, such as CBD oil, the government missed a key point in that THC is proven to be an effective medicine for chronic pain, MS spasticity, chemotherapy-induced nausea and vomiting, as well as other conditions. In response to the government's plan to apply a sin tax on medical cannabis, CFAMM launched a campaign called Don't Tax Medicine. To date, over 20,000 Canadians have written letters to their MPs calling for the elimination of tax on medical cannabis. A dozen leading national health charities joined our coalition calling for the same. We conducted a public opinion poll that found only 2 out of 10 Canadians support applying a sin tax on medical cannabis. Needless to say, both the general public and the healthcare communities overwhelmingly support eliminating tax on medical cannabis. It's time for the Canadian government to step up and treat medical cannabis as a medicine. That means no tax, and especially no tax for medical cannabis patients. We're asking the committee to amend Bill C-74 by exempting medical cannabis from excise tax. By amending the bill in such a way, the government will help ensure medical cannabis patients are treated more fairly and won't have to pay an unjustified and misguided tax on medicine they need. The bottom line here is that this is a question of fair and equitable tax treatment when it comes to medical cannabis, and the only answer to that question is don't tax medicine. I want to thank the committee for your time, and I'm happy to take your questions.
Thank you both.